kidney failure or kidney disease or kidney insufficiency. This is also referred to as renal failure or renal insufficiency. As we all know, our kidneys are incredibly important for us to filter so many things. And none of us want to live the end of our life or any part of our life on dialysis. But we're at increased risk for dialysis if we have these pathogens that we are looking for on the spit test, and a markedly increased risk of renal failure or kidney failure if we have diabetes. And we've talked about the fact that there are 36 million people in the United States right now with type 2 diabetes, and there are 97 million of us out there with prediabetes that may or may not know it. These two conditions markedly increase our risk for moving towards kidney failure in our lifetime. So everyone would benefit from the spit test to determine if these pathogens are present. And especially if you have seen worsening blood tests and your doctor has been concerned about your kidney test or your renal tests, this is the time to get the saliva test to see if one of these microorganisms could be contributing to the problem. And also because we want to understand if we're at risk for not only kidney disease, but it's closely related to diabetes. And we want to understand if we're headed towards fatty liver disease. We talked about those separately, but because these microorganisms are carried in the blood vessels to all of these organs, and because the liver and the kidneys must do their job very well, or one or the other suffers. In other words, the liver and the kidneys both have to filter. They filter slightly different things and they filter in a different way. But not only do they just filter out the toxins, but they also are incredibly important to put back in a healthy state in the GI tract, gastrointestinal, and in the GU tract, genital urinary. So both of those mechanisms are incredibly important and we have to keep them healthy. And we must make sure that they're not becoming unhealthy or affected, either our kidneys or our liver, by the bacteria or the pathogens in our mouth, by the fact that perhaps we have an altered oral microbiome. So a saliva test and the screening test results from that will help you determine if you're headed for worsening kidney function and possibly ultimately kidney failure or renal failure, worst case scenario, dialysis. We also wonder why diabetic patients are oftentimes the ones that are on dialysis. Well, many times it's pre-diabetic patients that are on dialysis. And as I said, many people have prediabetes and aren't even aware that they have it. So get your screening test today by ordering the spit test to avoid a future that you don't want.